Welcome back to Midpoint. The emergency medicine physician at Cooper Hospital, Dr. Catherine Schultes, has been kind enough to join us for a second segment. Now, Dr. Schultes, let's talk about a new research study that says really bad luck, not bad lifestyle, is the primary cause of most cancers. Can you explain that?
Yeah, this new study from the Johns Hopkins is showing that about 2/3 of cancers are not related to lifestyle choices, but are instead related to genetic mutations. Your body's in constant renewal, and each time your cell divides, there's a chance for a mutation that can lead to cancer. And this study showed that about 2/3 of all cancers are related to these types of mutations.
Well, let's talk about those mutations. Is there any way that you can prevent or fight back against a random mutation?
Yeah, the thing is, you can't fight against it. It's not preventable. And I think that this research study is really important because less focus is going to look to try to prevent something we can't prevent and maybe look more into early detection for these types of cancers.
Well, what about like smoking, family history, staying out in the sun too long? Is there a strong relationship, though, between those factors and cancer? Would you agree?
There is, but this study showed that only about 1/3 of cancers are related to lifestyle choices and family history. So I'm not advocating for you to take up smoking or, stay out in the sun without suntan lotion, but I would say that, it does make us a little bit more aware that, 2/3 of these cancers we have no control over.
With developments in gene therapy, is it easier to identify hereditary genetic markers for the different types of cancer?
It is becoming, the more and more research that is done with stem cells and genetic mutations, we're able to target, but it doesn't necessarily mean that we can prevent that mutation.
What kind of advancements have we had over the last couple of years? It seems like every week we're hearing about something revolutionary in the fight against different types of cancer. What things get you really excited as far as what you're hearing in the science labs that really you can start, using with your patients in the years to come?
Yeah. So, I mean, in the emergency room, we see cancer patients all the time, and it's just the amount of new types of medications that are using to treat these cancers are just amazing. I would say that we need more information and more technology to look for detection, but right now, every patient I see is on a new medication that I haven't heard about and need to look up. So there's definitely been a lot of advancements in terms of the treatment of cancers.
We're talking so much about hereditary and bad luck. Do you worry then that at some point people are going to start having some of those bad habits, smoking and then using tanning beds? Is there almost like a difficulty or a concern talking about the hereditary aspect?
I would say that people are a lot more knowledgeable now than they were before. People know that, smoking kills, and it doesn't just not necessarily lead to cancers, but it also leads to heart disease, other ways that can kill you. So I think that, I think even though this study shows that only 1/3 of cancers are related to these poor choices, I think people are still going to make the right decision and, not smoke, use suntan lotion, avoid alcohol.
One of the things that people can do is, based on their family history, maybe get the proper testing done, whether it's mammograms or a colonoscopy. What would your advice be for people to make sure that they see a doctor regularly so that they can get these tests done?
I mean, it just shows the importance of a family physician. They're the ones that, see you each year. They're able to see, oh, you're turning 50. It's time for your annual colonoscopy. They know that you're behind on your mammogram. So having that family physician and having that relationship that knows your family history, knows if you need to start looking at detection earlier than most people is really important to have so that you're on top of all this.
When you're young, you think you're invincible, right? Are you seeing in the emergency room a lot of people that aren't going to see a family doctor, and maybe you're seeing them at the tail end of some sort of disease or problem?
Oh, we see it all the time. I mean, I think there's just a really big patient population between the ages of 25 and 35 where, they don't feel like they're as old as their parents. They aren't as young as they were used to when they saw a pediatrician. And there's a huge gap in time where they're not seeing a family physician. They're not getting their cholesterol checked. They don't know anything about their family history. And I think we do lose a lot in that time period.
And we got about 10, 15 seconds left. How about the other end of the spectrum? Elderly people, are they taking the proper steps to make sure that they stay healthy?
I mean, I've seen a lot of elderly people up to ages of 100, more and more. So I definitely think that people in their older age, they're living longer, they're taking care of themselves, and I think that, they're doing the proper steps they need to take.
Thriving when they hit 3 digits. Thank you very much, Dr. Catherine Schultes. We appreciate your comments today. And when we return, the field trip to Cuba that couldn't have been better timed. And next hour, the weapons no longer being used in Afghanistan are being moved to Kuwait.